Pregmeet viewers, welcome to the Pregmeet Show with me, Euphemia Kaleki. Today we are looking at low birth weight, but before we look at low birth weight, let's see what birth weight itself is. Birth weight is the body weight of a baby at birth. Though it is the very first weight of the baby at birth, it can be estimated or determined during pregnancy or in the uterus, and that can be done by the use of an ultrasound scan. And then we term it as estimated weight. Now, this estimated weight helps your care provider, who is the midwife or the doctor, to know the type of weight your baby is coming with. It also helps your care provider to plan your mode of delivery. If the baby is too big, they tell you how the baby should be delivered. And if the baby is too small, they tell you how the baby should be delivered. Now, when it comes to birth weight, we have three types, okay? And we have the normal weight, which varies from 2.5 to 4.5. The 4.5 is in the Western world. But when you come to Africa, it ranges from 2.5 to 4.0. Then we have the low birth weight, which is a weight that is less than 2.5. Then we have the high birth weight, which is a weight that is above 4.0 in Africa and 4.5 in the Western world. And in today's discussion, we are focusing our education on low birth weight. With me in the studio is Miss Mabel Katano, who is helping us with the discussion. Miss Mabel, you are welcome to the show.
Thank you.
Okay. You look good, by the way.
Thank you. We are looking good as well.
Thank you. All right. So we are looking at low birth weight, okay? But then there are some factors that affect birth weight of a baby, actual birth weight of a baby. What are some of these factors that affect the birth weight of a baby?
Some of these factors are the maternal or paternal structure.
Okay.
Then we have the conditions of the placenta.
Okay.
We have condition of the baby.
All right.
Itself.
Yeah.
Yeah.
Okay.
All those things can
affect the weight of the baby. So a mother like me, as malicious as I am, when I give birth and my baby is small, it's okay, right?
Yeah, in that case, depending on the maternal, like the gestational age of the baby,
okay,
it can be termed okay.
Okay,
yes.
All right. So today we are looking at low birth weight. Okay. So what is low birth weight?
Low birth weight is a body weight of a baby that is less than 2.5.
Okay.
That is termed low birth weight.
That is at birth. When the baby is delivered.
When the baby is delivered. That's the first weight taken.
Okay.
Yes.
So when a baby's weight taken at birth is 2.5, it means the baby has low birth weight.
When it is below 2.5, the baby has a low birth weight.
Okay, thank you for the clarification. But with this low birth weight, why should mothers have low birth weight? Yeah. Or why do mothers have low birth weight? What causes it?
There are two main causes of low birth weight.
Okay.
And then the first cause is prematurity.
Okay.
Prematurity is a baby born before the 37 completed weeks.
Okay.
So such a child is termed preterm baby.
Okay.
Yeah.
And then the second one, you said there are two main causes. The second
one, we have intrauterine growth retardation or restriction.
Okay.
And in that case, it means the baby can grow up to 10, but then the weights might not correspond to the gestational age. So in that case, it means the baby has a slow growth when in the mother's womb or in utero.
Okay.
Yes.
Okay. But then, aside these two causes that you've mentioned, are there some things that we do as mothers or as pregnant women that affects the weight of our baby, that we end up giving birth to a baby below 2.5, with a weight below 2.5?
Sure, there are a number of things that we do that predispose us to that.
Okay.
And then one of them is multiple pregnancy.
Okay.
We have substance abuse.
Okay.
We have age less than 15 or above 35 years.
Okay.
Poor maternal weight or BMI before
pregnancy. Okay.
All such things can predispose you to
having a low birth weight
baby.
Okay.
We also have domestic violence. We have maternal conditions during pregnancy. We have maternal conditions before pregnancy. All those things can predispose you to have a baby with low birth weight.
Okay, hold on. You said we have conditions before pregnancy, and then we have conditions when one is pregnant. So it means that one can have a condition before becoming pregnant, and that can affect the weight of the baby. And then when you are pregnant too, some conditions can arise that can also affect the weight of the baby. Can you tell us some?
Yeah, there are conditions before pregnancy, conditions like hypertension. When you have chronic hypertension and you get pregnant, it can affect the baby's weight. And then conditions during pregnancy, somebody might not be having hypertension, but we have something called PIH, pregnancy-induced hypertension. When one gets pregnant and then you have such a condition, it can also cause you to have low birth weight.
All right. Okay. There was a client who complained of her being diagnosed of the amount of fluid around her baby being reduced, and for that reason her baby have to be delivered before the due time. Can that one have something to do with low birth weight?
Yeah, reduced amniotic fluid around the baby is one of the predisposing factors to having a low birth weight baby. Yes, because when it happens, so the baby has to be taken out. So the baby might not get to term, but the baby has to be delivered so that it doesn't result into death or anything. So in that case, that baby will end up being prematured.
Okay. But what of babies that have issues? Because you see that we have some babies that have been delivered with some complications or some abnormalities. What of those babies? Do you allow them to get to term before you deliver them?
Those ones are also some of the causes of preterm. A baby that has a condition in utero, or a baby that has chromosomal abnormality.
So how do you diagnose low birth weight? How do you know that this baby is low birth? Is it only at delivery, when the baby is born and then the midwife's weigh? That is when you know that the baby is low birth?
There are many ways of knowing, knowing the weight of the baby. One, during your antenatal days, we use a SFH measurement. That is symphysiofunder height. Every time that the pregnant woman shows for antenatal care, we measure the abdomen to see whether the baby is thriving. So when that measurement continues being static, that tells us that no, there is something going on. The baby is not growing to the level is supposed to.
So is low birth weight, or we have classifications of low birth weight?
We have two classifications. We have a very low birth weight, and we have extremely low birth weight. The very low birth weight is birth weight below 1.5 kg. That is then very low birth weight. And extremely low is birth weight below 1 kg.
And a birth weight of 1 kg.
Yes. That is extremely low. Birth weight. So with the weight that you have mentioned, a baby with 1.0 and then 1.5, when you deliver such a baby, what do you do? Actually, with this type of weight, it's a condition that leads to.
But before you even continue with what you do, how do you show such a baby to a mother that this is your baby, and the mother will look at the baby of 1.0 or 1.5? How do you break the news to the woman?
One, because something led to the delivery of the baby. Things has already been explained to the woman, so the woman is in a way expecting
a small baby like that.
The baby will definitely be small.
So it looks like mostly mothers of this baby are already aware of their.
cancelled.
Oh,
I
okay.
understand.
Okay. Okay. So how do you care for these babies when you deliver them?
Normally, these babies, before you deliver them, if it's in a facility that doesn't have NICU services, the mother has to be referred to a facility with NICU services.
Okay.
Because such babies has to be cared for at the NICU.
All right.
Yeah.
All right. Thank you so much for coming. All right. So on today's section, we'll be ending it here. What do you have to tell us?
Yeah. What I want to tell mothers, women, when you are sexually active, you can get pregnant at any time. So we need to be watchful of our lifestyle. Self-medication, all those things wouldn't help us.
Okay.
Yes. So we need to be very careful.
Since all these things affect our babies.
the birth weight of
Our babies. Thank you so much for coming. Thank you very much for coming. And thank you, viewers, for joining us go through this section successfully. Don't forget to subscribe to our YouTube channel, The Pregnant Cutters. Follow us on Facebook, The Pregnant Cutters. On Instagram, The Pregnant Cutters. TikTok at Pregnant. And then you can also send your messages to us on WhatsApp by 0248526641. 0248526641. Don't forget to like our videos and drop a comment. In fact, the comments are very necessary. Drop your comment. Let's know how the education is going. Let's know whether you are enjoying the education, if it is effective, if it's good for you, it's going well for you. You are actually understanding the education. If you have questions, you can also drop it there. You can also share your experience with us. It is The Pregnant Show with me, Euphemia Okaleke. See you on our next episode.